Good evening, everybody. Welcome on in to another installment of Medical Talk in Layman's Terms with Nurse Charlene. And I am Nurse Charlene. And yes, we're going to be talking about my LLC, which is called Your Body's a Snitch, Believe It, and what that really means. And tonight, I hope that I can get through with it. But as technology does what my friend said, the donkey, which means it's acting a darn fool and stuff. It's being very special. Never seen nothing like this. But I'm gonna try to go ahead and hopefully everybody can hear me when you get on and everything and stuff. But I'm gonna go ahead and try to push on through this podcast and hopefully it'll be at least nice enough to let me go ahead and broadcast. Medical Talk in Layman's Terms with Nurse Charlene is something that was founded March 4th, 2025. And so now we've passed a year, still doing it, and 3 years in total of me doing podcasts, medical podcast and everything and stuff. So, it really is for the benefit of you and me and everything. But as things go along and things go crazy and stuff like that, I guess technology got a mind of its own because it is acting a super fool with me right now. I'm like, I don't understand it. I'm trying to put somebody else on and stuff. But definitely somebody then commandeered my whole podcast and everything and stuff. But I'm gonna see if it lets you guys let me know if it's not letting you hear me or something weird like that and stuff. But so far it looks like it's on and stuff. So I'm gonna go ahead and go through with it. And tonight the subject is talking about my LLC, which is what it's all really about and stuff. As you can see on my board behind me, I take my time and make all these little kind of cartoonish things, but everything is a lot of thought put into them when I put them in there and stuff, like the brain, and stuff. And then a person, worried and stuff. And the last one at the bottom over here is the stomach, and then your body as a whole, up here and stuff, and what is it talking about and everything. So I'm gonna go ahead and try to push through it, y'all come on in and stuff. As you can see in my little ticker right here, it says hyper up. The nurse wants you to ask questions or talk about it or give your comments and everything. Nothing is too dumb or anything like that. We don't do that. We don't judge or anything and stuff. We're just trying to get through the podcast and see where it goes, from there and stuff. But definitely welcome on in and everything. So before I start, so that I stay inside the Facebook, YouTube guidelines of social media and everything, this is a podcast and it's an educational podcast, and I'm a educator slash real live registered active duty nurse and everything. So I'm not coming on here just saying this or saying that and stuff. I'm actually trying to get through to you guys and stuff, what's going on and everything. And I got my first wonderful and beautiful young lady on, and her name is Rosie Granny Allen, and that is my mom. And she sits back and listens to it. And when we are lifing and life has taken place and stuff, she comes on and stuff. If she's in a hospital, even, she will kick me out the hospital, make me go home and do my podcast, and then I have the right to come back up here and see her. But she says, this is important. I need to, help people, and I have. And I thank God that's why I'm still on after a whole year of doing this and everything and stuff. You might see a couple people here and there on, but as they look at the replay and stuff like that, thank God they're listening, they're catching on, they're understanding that this is really something and not just, just any old ordinary podcast just popping up just because it's a hobby. and everything. So I'll read my podcast disclaimer first, if you grant me that and stuff. And it says, welcome to Medical Talk in Layman's Terms with Nurse Charlene, where health and illness are broken down into simple, easy to understand conversations. That's what we're having, a conversation. This podcast is for educational and informational purposes only. While Nurse Charlene is a licensed registered nurse with extensive healthcare experience, the information shared here is not intended to replace professional medical advice, diagnosis, or treatment. Very important. Every person is different. What works for one individual may not be right for another. Always consult your doctor, nurse practitioner, or qualified healthcare provider with any questions you may have regarding a medical condition or before making changes to your health, your medications, or your lifestyle and everything. So, if you think you may have a medical emergency, please hang up and no, call 911 or seek immediate medical attention. That's very important. We're talking about medical stuff, so that's what you got to do and everything. And if you think, also the views shared on the podcast are based on professional experience and general medical knowledge, presented in layman's terms to help bridge the gap between healthcare and everyday understanding. By listening to this podcast, you acknowledge and agree that this is not a substitute for personalized medical care, your own personal doctor and everything. No provider patient relationship is established, and you are responsible for your own healthcare decisions, even getting on here to learn something. And remember, your body speaks. Your body's a snitch. Believe it, listen to it, respect it. And when in doubt, check it out with a medical professional. If you got a question, go to the doctor and stuff. It could be the difference between saving your life or you passing right there on the spot, or your family member, whoever you're trying to seek, information for. And thank you for tuning in and taking a step towards better understanding of your health. Thank you, guys. Welcome on in. Let me see who's on there. Auntie Josie. She says, hello, everyone. And hope everyone is doing well. Yes, I also hope everyone is doing well. And definitely, if you're not, that you're getting it checked on and everything, because we got to tell on it. It snitches on us. The least we can do is tell on it, and everything. So I said earlier and stuff, you guys and stuff. Oh my God, Jesus. Woo! And stuff. Uh-oh. Can y'all see me? Oh, it's doing the dunk on me. Oh my God. Excuse me, and I might have to end the podcast early and stuff because my computer is glitching, it's doing all types of little crazy things. I'm gonna have to run some type of diagnostic on it because I am the IT guy and everything and stuff, but it is acting a fool and stuff. And it started about 15 minutes before. Oh yeah, you can hear thank you, Auntie Josie and stuff. I'm gonna do my best, but if it keeps on acting up, please forgive me and stuff. I'm gonna have to go ahead and come off air and everything because I don't know what else to do and stuff. Yeah, I've been doing it on this computer for a few years now and stuff, but this is the first time I ever seen it go like buck wild on me and everything and stuff. But hopefully, I prayed about it and stuff. But you guys really do. If I do happen to miss this podcast because it's my computer is glitching and stuff like that, I will be sure to come on and give you a nice comprehensive replay of it and everything. I might even do it on a different day, like a Thursday, just to let you know and stuff. But for now, let's see if I can get through some of it, and hopefully things will get better and stuff. So welcome on, you guys. Please forgive me and stuff, but electricity and electronics and stuff, they do what they want to do and everything. It seems to be showing me that it's okay a little bit, but it's still got this little thing popping up and stuff, doing all this little devil dancing on me and stuff. But yes, so I'm gonna go ahead and just start it. And if it acts up too bad and stuff, I send my love to you, but I'm gonna go ahead and get off. And then I'm gonna beat up the computer. No. But guess what? Life on me too. And the computers glitch on me too, and all that good stuff. So I don't get to be super special and stuff like that. But yes, let's see what we can do and stuff. So your body is a snitch, believe it. That's the topic and stuff. Why am I doing this? Why she keep getting on here every Tuesday talking about some medical stuff and what's she doing? What's happening here? Well, I'll tell you and stuff. Your body is a snitch, believe it, is bridging the gap between healthcare and everyday understanding. And it's presented by me, Nurse Charlene, the host of Medical Talk in Layman's Terms with Nurse Charlene. My mission statement is: Your Body's a Snitch, Believe It, LLC was created to educate, empower, and inspire individuals, families, caregivers, and communities to better understand health and illness in simple, everyday language. That's the problem and stuff, that when it's not everyday language and they just think that you're supposed to know what they what they know because they've been through medical school. So have I. But I can give it to you as simple as I can and everything. So our mission is to bridge the gap between complex medical information and practical understanding by providing accurate, easy to understand health education in a welcoming, non-judgmental environment where every question matters. We believe that knowledge is power. That is definitely true. Knowledge is power, and understanding your body can save your life. Understanding your body, or your body first, can save your life. About the podcast, Medical Talk in Layman's Terms with Nurse Charlene is an interactive educational podcast designed to make healthcare understandable for everyone. Hosted by Nurse Charlene, me, an acute care registered nurse with over 3 decades of healthcare experience. The podcast breaks down medical topics into simple, bite-sized discussion. That's what I'm getting on here doing. All that, the hypertension of the deviation of the septum of, no. The high blood pressure of this part of the wall of the so-and-so. You see what I'm saying? So I'm not going to do that, and stuff. So sometimes I'm not trying to be pornographic, but sometimes if I get on here, I can say stool, I can say bowel movement, or I can say poo-poo, dookie, something that you can understand. Because some people, that's all they need is that one little word. Bowel movement just ain't hitting the light switch for them. So I can say poo-poo or dookie, boo-boo, whatever you want to hear. You tell me, in the comments and everything. But that's what I'm doing and everything and stuff. And then guess what? You might save your own life or somebody that you love by accident. Because oh, your face, you got Your face is drooping on one side. Your arms won't do this. Oh, well, Charlene said that on there and stuff. If this happened, call 911. Always call 911. Always talk about your doctor. Always, and stuff. Tell on it. If you can't see, tell on it. If your hip is hurting, your knee is hurting, your ankle is hurting, you can't even barely walk. You can't even get out the bed. Tell on it. Tell on it. You might die if you don't, and stuff. So that's what I'm trying to get by this and everything. So that's what I'm doing. Bite-sized information. Welcome on in, my dad, Mr. Buckner, and everything. Welcome on in, my dear, and stuff. Glad that you were able to get on and everything. So my goal is to help listeners, listen to this, help listeners understand their bodies, recognize warning signs of illness, become better healthcare advocates, improve communication with healthcare providers, make informed healthcare decisions, and promote prevention and early intervention. Early means telling somebody about it early, when you get the first headache, when you get the first fever, when you get the first this, the itch, the scratch, the swelling and stuff. If you get it right then and there, that's a chance that you catch something before it turns into the full-fledged whatever it was going to morph into, and stuff like that. So you telling on it right away and stuff instead of playing games, and stuff with your body. You only get one. It'll never be another you. Thank you, Daddy said yes and stuff. So why is this podcast different? Because I'm on it. I'm hosting it. That's one thing, and I'm different, and stuff. So you already got that going for you. I'm also a leap year baby and stuff. So I mean, that might be some things that might be coming on there, that I got going for me and everything and stuff. But also, why is it different? Because many people leave the doctor's appointments confused. I don't know what he said. He said something about my potassium is low, or he said something about I need to get a shot and they need to get some blood. Why they want to get blood from me? They always trying to stick you and stuff because they trying to find out what's wrong. Yeah, they don't want to just stick you just for nothing. Remember, is you your doctor family member? Is you his cousin or sister or brother or, whatever? Yeah, he don't know you. She don't know you. So how do you make them know you? You actually got to tell them something. They not nosy. They don't know you. And if you don't want to tell them and you like, I ain't going to tell them that my sister got diabetes and my brother got diabetes. And so guess what? You going to faith around and find out. Yeah. You're going to find out and stuff. Unfortunately, because if you didn't tell him, he ain't going to dig no more. She ain't going to dig no more, your doctor, and stuff. They just going to let you go ahead and go, blind. They going to let you go on and have super diabetes so you can have a stroke and a heart attack. And then, whatever that equals, and stuff and everything. So one more thing I just want to announce and stuff before I get all the way deep into this. And that's the fact that my computer is glitching. So it already kicked me out once, so I ain't gonna even touch the mouse or nothing. But I just want to let y'all know that I'm human too, and I already thought about punching the hell out of the computer and stuff. But I probably would break it, so I'm gonna be good and stuff. But I don't know. I'm gonna give it some love. I'm gonna defragment and all the little good stuff. Anybody that got some advice, y'all can message me on Facebook. If you're my Facebook friend or something like that, and let me know and stuff. But yeah, it's doing the, like I said, one of my friends said, I like it. She said, it's doing a donkey. It's acting a fool and stuff. But I'm going to just keep on going. And if you see me stop or you see me freeze, like, or something like that, just let me know and stuff in the comment and everything and stuff, so I'll know to stop and just check it out and stuff, because I know how to get myself back on, but I don't know what it's doing, and everything and stuff. So bear with me, you guys, because this is an important one. This is why I'm even here. and stuff like that. Welcome on, Miss Maria, my cousin Maria, with her little pretty self and stuff. Yes, we getting on down. She said, "Hey, family," because when you on here, you all become a part of the family. The medical talk in layman's terms with Nurse Charlene family. So welcome on, you guys and stuff. And she goes, Maria said, "Be good, Charlene, to the machine." I've thought about it. I haven't acted on it, but ooh, I want to touch something or just pinch a button. I know it probably won't hurt. It probably hurt me more and stuff, but don't be doing that, and stuff. I'm like, I've been on here a whole year and stuff, and actually 4 years to be exact and stuff, doing this and stuff. And it's going, I'm like, okay, I'm gonna be good. I'm gonna be good. I'm gonna be good. I'm gonna be good, y'all. Yes, and stuff. So, going back to why I'm on the podcast and everything, many people leave the doctor's office confused. So why is mine different? Because they hear terms like this: hypertension, neuropathy. Oh, I know everybody know that word. And so I bet you could break it down too, huh? And stuff. Remember, congestive heart failure, COPD, OPP, okay, A1C. Oh, no, let's make it fancier because that wasn't fancy enough. Hemoglobin A1C. I know you know all of that, huh? Stroke. You know everything about that, right? Sepsis. You got some sepsis. If somebody told me that 40 years ago, I'd be like, yep, I don't how I get rid of it. Oh, you ain't gonna tell me? Okay, I'll go home and take some Alka-Seltzer. I'll go home and take some Tylenol. It'll go away. It ain't going away. Tylenol ain't gonna cure bipolar depression, anxiety, PTSD. You see what I'm saying? So it's I'm frozen, or did I come back? Oh, okay. Auntie Josie said, "Not mine." It's gonna freeze a little bit and stuff, but hopefully I'll be able to still get through this one and stuff. This is probably the hardest one in my life, and it's the most important. So if it does act a fool or something like that and stuff, and I go ahead and get off and stuff, I'm gonna do it again. How about that? And stuff. But y'all bear with me. Y'all know that y'all know and love me and stuff like that, and I know and love you guys and stuff. So I really want to get through with this one and everything. So I said, why is the podcast so different? And I gave you all them terms that I know you know everything back and front. Okay, because you could probably teach me and stuff, but yet they may not fully understand what these terms mean. We translate medical language into everyday language. Okay, so then I'm gonna give you an example. Yeah, yes, this is some good stuff. Huh? Oh, cool. Welcome on in, everybody. I can't see everybody and stuff, but let's keep on working it out and stuff. Let's see what happens and everything. So we got, instead of saying your glucose levels are elevated due to insulin resistance, I explain it in a different term. I would say your body is having trouble moving your sugar into your bloodstream where your cells are, so that you get energy inside your cells that help you move yourself every day, or something like that, where it belongs. It needs to go into the cells where it belongs. That's where the sugar is supposed to be, not just floating around messing up other stuff in your bloodstream. So that's what that's called and everything. And then another one, your body is simple, clear, and bridging the gap. So that's what I'm trying to do, make it understandable for you and everything. So then you got bridging the gap between healthcare and everyday understanding. Healthcare should not feel intimidating. It does. It does to me, and I've been a nurse for 25,000 years and stuff, and everything. So our platform, or medical talk in layman's terms, we want to, for the patients, understand your diagnosis and treatment. For the families, learn how to support that loved one that has an illness. It doesn't matter what the illness is. It could be a stroke. It could be lupus. It can be congestive heart failure and stuff. But helping the family to understand it, helping the caregivers gain practical knowledge and confidence to be able to walk in there and tell you, these caregivers, I'm a caregiver and stuff, being able to, tell the person with confidence, hey, this is why this is doing this. That's why that's doing that, and stuff, because that's what, that you need. And that's what you need. You need clear understanding so that you guys both know, because they don't know. Now, dementia, it might be harder to understand that if you got a certain kind of illness, but at least that caregiver understands your illness, so then they have more confidence instead of saying they just be forgetting everything. I don't know when they hear, when they gone on to La La Land or something, but you'll be able to help them. You'll be able to treat them and nurture them better because you'll have the confidence. You won't be confused as they are, and stuff like that. So that's what we're trying to do. In the community, promote health and awareness and prevention before it even gets there. That means checking on them blood pressures, going to those little health fairs and stuff like that, and doing things like that to have a better understanding and to be able to make things happen for you. Definitely, and stuff. And then for healthcare workers to share knowledge in a relatable way. Your doctor need to talk to you on your terms, not his, because he had 100 years worth of education. He didn't read the whole dictionary back and forth and the PDFs and all the little different things and stuff that doctors go through and stuff, or nurse practitioners and all these different people and stuff that they go through. They have a certain way. Can you hear me, Rosie? Not just because you in the room right there. But anyway, I'm saying this to say that so that they can be relatable. We need to close that gap so that you're not scared to tell a doctor that your grandmother had COPD, that your grandfather had diabetes and all of that stuff, but that you tell them that you tell them that somebody had this, or somebody had multiple sclerosis, or Guillain-Barré disease, or and stuff, big old word, sickle cell, or something like that and stuff, that so-and-so had a heart attack, and then such and such had a heart attack, and so-and-so. So that means that you might be set up for a heart attack. You was in that family. You might have ate the same thing they ate and stuff like that and stuff. So it would help, to be able to tell that information so that your doctor, like I said, they don't know you. You're not their family. You're their patient. They make money off of you. So at least if they're making money off of you, they can talk to you correctly, and you could talk to them correctly. You could come with your little setup of 5 questions you want to ask. Why is my butt always itching? Why is my finger feeling like it's going to fall off and it's blue? And stuff like that. Why did I do this and why did I do that? You want to be able to get that in there. You want to be able to explain that to people and stuff so that they know how to treat you. Give them a reason and stuff. I found that over the years, this is over the years though, because I've been a lot of things. I've been a CNA. I've been a medical assistant, a medical office manager, a certified phlebotomist, a certified EKG technician, a charge nurse and a nurse. I've been in acute care all my whole career, as a nurse and counting and stuff, in acute care and stuff. So I've been around so many people and so many things. And the thing that rings true is when they talk over your head, it's going to always be a problem. You're going to be the one that say, I'm not going back to that doctor. They don't even listen to me. I hate that doctor. Not even knowing that you can change your doctor. If it's that bad and the doctor is mean and spiteful to you and you mean and spiteful to the doctor, y'all probably need to change and switch hands. You need to go to another doctor. I don't care if that one convenient. Go somewhere else where they're going to actually, treat you and be ethnically sensitive to you and stuff, and where you're at. Yeah, you don't have 15 degrees like they do. So why don't you go to a doctor that won't talk to, that has the 15 degrees? I have 4, and stuff. So going to that nurse that has 4 degrees, but doesn't ever talk to you like I got 4 degrees. So I'm going to tell you in the deviation of the so-and-so and the kleptomania of the such and, yeah, I'm not doing that. I'm going to say, yep, you need to go to the doctor. If they send this person home, you need to go back. You need to go back again. Go to another hospital. Go somewhere else. They not caring and stuff. It's going to catch up with them because everything is charted. It's a paper trail and stuff. So when at the end, when you find out that it was a neglected care or something like that, you get to go back and see them about that and stuff. Pay attention to me. I had the nerve to tell on myself that something was wrong with me. And you mean to tell me you're not going to help me? Let's get to the bottom of this and stuff. I'll tell you everything I know and stuff. Oh, okay, you said you hear real good. Thank you, Auntie Josie. Yes. Wait. Mama Rosie, you said you can't hear me? Oh, no. Yeah, but you can't hear me on the online. Y'all let me know what's going on and stuff. I'm sorry. I did come on and say that my computer is doing the donk and stuff like that. And it is. And somebody already told me, because I seek therapy sometimes and stuff like that. Somebody told me don't beat up the computer, don't punch it and stuff. So I'm gonna be good and I'm gonna try to get through this and stuff. So y'all just let me know and stuff, because I really think this is important. It's why I'm here. I happen to have the nerve to actually pray before I get on here, study before I get on here, and bring you the best information I can, the best way I can deliver it. Everybody has a different delivery system and stuff, but this is the best way I can. And I feel like I'm even helping the doctors by getting them to understand that you got to talk to the patient the right way so that they don't think that, dad said he could hear me real good and stuff. Oh, wait, I see Auntie. Oh my God. Let me see if it's going to let me back on and stuff. Uh-oh. Yep. Ooh, 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 ooh. Rosie, hide the hammer. Hide the hammer, because I'm going to get to this computer and stuff. Hide the hammer. Ooh, sweet baby Jesus. Okay. So Auntie Josie said, my brother went to the doctor yesterday and found out the nursing home was giving him the wrong, the wrong medication. And now his stomach is blowing up. I need to do some investigating. Absolutely. Oh, I see you said you're going out, you're back and stuff. Thank you, Auntie Joe. See, that's why I'm going to stay on no matter what and stuff. It might kick me off a couple times and stuff. I'm going to try to be good and keep my hands away from touching things and stuff. But yeah, see, that's what I'm on for, that type of stuff, because the nursing home was given the wrong medication. And see, this as a patient, and stuff, Uncle, he knows that I need to follow what the nurses say and stuff, and I need to take my meds and everything. But what happens when you're getting the wrong medication? Unfortunately, it's called medical malpractice. So we will talk in depth about that after the podcast and everything and stuff. But that type of stuff happening um, is actually kind of common in certain areas and stuff like that, and it's really hurtful because we already are feeling some type of way about our family, which is actually very traumatizing and stuff like that. And then you add the fact that they were supposed to be getting these therapeutic stuff, because we feel a certain way. They're not at home with us, but if they're home with us, I don't know how to treat it and stuff. So you entrust somebody or a facility to take care of your loved ones, and then they give the wrong medicine or do the wrong this or take the wrong test, and it hurts you somehow or causes harm to you, or it causes a decline in your health even worse than what it was already and stuff like that. That's all the things that I'm talking about. What if you didn't know that even happened? Or what if they didn't tell you exactly what exactly happened and everything and stuff? That type of stuff, yes, you got to absolutely get on that right away and stuff, because it can be swept under the rug, and everything. But somebody needs to find out, because it starts with something. How did the nursing home even get the medicine unless did the doctor order the wrong medicine? We need to find out where it started at and why this medication was sent instead of another. Did the pharmacy send the wrong medication over and then that happened and stuff like that? Because that could be the matter between life and death. If you got high blood pressure and I'm giving you a salty medicine that will make your blood pressure shoot up to the moon, which will give you a heart attack or a stroke and stuff easily and put you to sleep forever and stuff like that, then what happened? The chain of command. Did it start with the doctor? Did the doctor prescribe the right medicine? Okay, so the doctor did. So did the pharmacy send the right exact medicine over? Okay, the pharmacy did. Now, did the nurse put this medicine in somebody else's profile instead of that, instead of the person's profile and stuff? So you see how that breaks down and stuff? That's exactly what I'm talking about. But being able to know that that's what you got to look at. So you see how Auntie Josie, you're thinking ahead of time and stuff, like, his stomach is blowing up and we need to do some investigation. You absolutely do. But what if I don't want to ruffle feathers. I don't want to, and stuff. They gonna correct it, and stuff. No, how did it go wrong in the first place? Are you gonna still keep on giving stuff wrong? Maybe we need a different place, and stuff. Maybe this is not the place for him. And maybe he might need another nursing home that can make the right decisions and check the medicines and double check. You're supposed to be double checking. That's what we do in a hospital, setting and stuff. So this is very important and stuff. And it could be the matter of between life and death, or even just a worst case scenario. He living out his last days and stuff in pain or discomfort because of something simple that should have just been double checked. Okay, if you can understand that and stuff, that's what I'm talking about and stuff. And believe me, 22 years in acute care nursing and stuff allows me at least that much expertise to know that was not right and everything and stuff. And that's very important. So we will talk about this behind the scenes in a sidebar and stuff like that. But I'm glad that you were able to come on and tell me that and stuff, because that's important and everything. So we do head to toe education. So this is where health education on Your Body's a Snitch, Believe It, with medical talk in layman terms with Nurse Charlene and stuff. And one of the biggest things I do is I break down the body. But I go by what I'm hearing from people. I go by, because I want to respect you. If you have the nerve to go ahead and tell me that this is wrong or that's wrong, or you have problems, or you hot flashing, or whatever it may be and stuff, I want to be able to come to you and stuff, and we can talk about it and stuff and kind of unpack it, sorted out and everything. Welcome on in, cuz Antoinette. She says, sorry I'm late. I'm here cuz I fell asleep. Oh yes, tough PT. She just had surgery. Cuz guess what cousin Antoinette did? She told on it. And she had to have surgery. But what would happen if she kept on walking till she was crippled, never had the surgery, never was a candidate because it got so bad that she's now crippled and in a wheelchair for the rest of her life? Exactly. But she told on it in enough time to get it repaired. You see what I'm saying? That's the difference. Oh, it's just my ankle, or it's just my knee, or it's just my hip, and stuff like that. And then, so you ain't gonna do nothing about it? See, now that she on here, I done brainwash y'all into telling on it, yes, and stuff. So no, you're not late. And actually, it's a real bad night, y'all. Please forgive me and stuff. My computer decided after all these years, it decided that it wanted to do the dirty dime on me and glitch. So it's doing a fool on me. But as long as I can see myself moving and stuff like that, then I know that I'm still on and everything. So if I pop off or something like that and stuff, just know it's not even a Wi-Fi problem. They got the nerve not to be Wi-Fi. It's the computer saying, I hate you. You got too many tabs open. I couldn't close them in time and get on. So I'm gonna close them up though, and everything and stuff. But in the meantime, thank you guys for coming on. Thank you for the respect of just knowing that I have something good to say and everything. Welcome on in, Auntie Rena. She said, hey, beautiful lady. Oh, she called me beautiful. Thank you and stuff. But she said, hey, beautiful lady, I'm here. Thank you for coming on and stuff. The topic tonight, cousin Antoinette and Rena and stuff is it's about your body's a snitch, and why I picked that. Your body's a snitch, believe it. That's my LLC. And it's because it be snitching. It tell. Guess what it tell? A fever is a snitch. A cough that you can't get rid of is a snitch. Lower back pain. Oh, it's a snitch. It's not just for Tylenol. It's not for Norco. It's a snitch. My butt hurt and it's sending a nerve pain all the way down to my foot and I can't walk. Yeah, that's snitching. Your body's a snitch. Believe it. It's in there. It's telling. It's trying to do what it do, and everything. That's where that's coming from. Oh, cousin Antoinette said, that's okay, cuz you do your thing. Okay. Whatever you can get out of it and stuff. If you guys need more and stuff, I'll do a part 2. But I'm really just talking about my business, and stuff, and what I'm doing and stuff. Medical talk in layman's terms with Nurse Charlene and stuff, and that it's really a thing, and stuff. And it's going to catch on because it's really doing the right thing, not just, somebody coming on and playing with you and wearing sparkly stuff. And glitter does make everything better, but okay, and stuff, wearing sparkly stuff and everything. But it's actually really about some medical stuff. So even though I get on here and I may joke, because I don't want it to just be serious, and yeah, you don't need that. You're on a podcast on social media. You need some liveliness. You need some cartoons in the background, some little graphics, going on and stuff. You need all of that. You need me on here cracking a joke. It might not be funny, and some of them are, and stuff like that, and all the good stuff and everything. You need me to shout out and let you know that you're important. I see you. And even if I didn't see you or something and I didn't give you a shout out, I'm giving you a shout out now. Anybody that took the time out of their Tuesday evening and stuff to come on here with me and my glitching computer and stuff and listen to some good stuff. Thank you. You just leveled up. And everything. So thank you for taking the time out and stuff for yourself. So I talked about the different things and reasons why I'm on here and stuff. One of them is I do head to toe health education. I'm going to tell you why and everything. We're going to discuss, from time to time, any, podcast that I do on Tuesdays at 7 p.m. starting and stuff. We discuss health and illness from head to toe, one issue at a time. For instance, neurological disorders. Okay, don't worry about the neurological. I'm going to tell you what's neurological and stuff. So disorders means something that's not right and stuff on your body and stuff. Like a stroke, that's neurological. It's your brain. Your brain is where the nerves are and stuff inside your brain. You got 1 billion nerves because it's your computer system of your body and stuff. Like this one is most of the time it's not glitching like my computer, but okay. I resent it right now. But anyway, dementia. That's a neurological disorder. Parkinson's disease, when the hand and they be, and stuff, and they don't want to do that and stuff, but it happens. It's a neurological disorder. Nerves are all over your body. So if they acting up, okay. So you see what I'm getting at? Multiple sclerosis, a neurological disorder, an illness. And everything. And these are things that you might have heard. You ain't going to know every single one and stuff. But that doctor, if you are diagnosed with any of these, that doctor better tell you in your way of understanding what you got. He don't get to say it's a neurological disorder and the deviation of the blah, blah, blah. No, of the Coors Light, of the 1800. And no, he don't get to say that. He get to say what it is. So one is neurological. That will be your stroke, dementia, Parkinson's, and multiple sclerosis. Mental health. Oh, they just crazy. And crazy ain't a diagnosis. So you just said, oh, they just that. Yeah, it's not a diagnosis, okay? And stuff. Mental health. Depression. That's mental health. Anxiety. That's mental health. PTSD, post-traumatic stress disorder and stuff. That's mental health. Bipolar disorder. Ooh, they so bipolar. Do you know what it means? Well, be quiet. You probably got it. I'm just saying. Okay. Cardiovascular. Oh, what is a cardiovascular? Oh my God. Is that a car? Is it what is it? Okay. Cardio means heart. Vascular is your veins and arteries, the blood carriers and stuff. So it's your heart and the things that carry the blood to your heart and back and forth, like your veins and everything. And that's what it's basically saying. Okay, you're not going to know that all the way. But if you got a cardiovascular disease, they better tell you which one you got and why you got it in your terms that you can understand. So you see why I'm here? Because I'm going to tell you, and then you're going to go back and tell your doctor a little thing or two. Time to level up and start taking care of me like you're supposed to. You get money. You got a check. You bought you another house with just mine alone, my appointments. Help me. Okay. All right. And stuff. I said for cardiovascular health, high blood pressure, not hypertension. And so do you know what it means? Okay, exactly. And stuff. So hypertension actually means high blood pressure. Okay. And then heart failure. Sometimes they'll even go as far as saying congestive. What type of heart failure? What heart failure means is the heart is failing to do what it does best. Keep you alive. Is if it's supposed to beat boom, 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 it's going boom. I guess boom, and stuff. It's failing to do its job. You see what I'm saying? You need to know that if you're diagnosed with it. Okay. Heart attack. It's an attack on your heart. That means somebody then beat the heck out of your heart. So it's a heart attack and stuff. So you see where I'm going with that and stuff. So then there's arrhythmia. So you wouldn't know what that is, but A always means against what it's supposed to do. Your heart's supposed to have a rhythm. Boom, 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 boom. What if it go? Boom, 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 boom. Yeah, somewhere along that line. Why you had to do them other ones? I just want boom, 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 boom. I don't want brr. I don't want boom. And stuff. I want my heart to be like boom, 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 boom. I feel like I'm alive. The other ones make you feel like you might be dying, and stuff. They give you signs. You feel it, and stuff like that. So that's where that comes in at. Okay, moving on. Respiratory condition. You got a respiratory is referring to you breathing. Okay, your lungs, and stuff like that. But we're not going to get all perfect on it and stuff. We're just going to say your breathing conditions, and stuff like that. Like asthma. Everybody might have heard of asthma somewhere along the lines, whether it was a kid or whether it was adult or both. Kid all the way into adult and stuff. Asthma. That's a respiratory condition. Guess what happens if you stop breathing? You stop being alive. So if you see, if I can't get no breath, I can't get no life, and stuff like that. So that's where that comes in at and stuff. Pneumonia. Okay. Nobody knows what that is. It's a P and an N instead of pneumonia. It should be like NEW, monia or something like that or whatever and stuff. Yeah. It ain't going to tell you that. It's just going to say pneumonia. It's a respiratory condition. That's all I'm talking about. And stuff. COPD. Chronic obstructive pulmonary disease. It's what it is, no matter how you got it and stuff. And if you are diagnosed with that, the doctor got to talk to you and your understanding of it and primary colors. He can't go to violet and mixing colors and light blue and coral blue and stuff or coral red or something like that. He needs to just give you yellow, blue, and green, red, white, and blue, and stuff like that when he's talking to you and everything. And if he doesn't, he's not doing well. If she doesn't, she's not doing a good job. Just as simple as that and stuff. Sleep apnea. Oh, and they got that machine that it be blowing on there like Star Trek. Yeah, that's what it's a part of and stuff. But it's a respiratory condition because respiratory explains that you got a condition that's not causing you to breathe with comfort. You can still breathe, but not with comfort. But if you stop breathing, yeah, that's discomfort because it's called you expired. You're not living no more. Let's get ready for the funeral, and stuff. So that's where that comes in at. Then you got some and stuff. Everybody gonna get mad at me, but endocrine disorders. Never mind what that is. It's just saying that I break these things down by talking about, guess what? Diabetes is an endocrine disorder. You see what I'm saying? Okay. So now you see where I'm getting at. Thyroid disease. The thyroid is right there. Sometimes, we call the man's Adam apple and stuff, and the women ain't supposed to have one unless they something else. But then you know what I'm talking about. But anyway, the thyroid is right there also and everything. And it's an endocrine problem, endocrine disorder, something bad with the endocrine or hormonal imbalances, meaning estrogen or your testosterone for men, and all of that. They doing a Donkey Kong or something like this computer is doing and stuff, by the way, and stuff. I'm still mad at it. But yes, it's dancing around doing a devil dance. But anyway, getting back to this and stuff, yeah, it's a problem. It's not right. So then that means it's wrong. Okay. Renal health. Not Rena, Auntie Rena. And so renal health. And that would mean the health of your kidneys. I'm going to give you that one and stuff because this is what I do when I'm coming on here and I give you one little thing. We're going to talk about blood pressure tonight. We're going to talk about your gut and all of that stuff tonight, and stuff. That's where I get all of this stuff from. There's so much stuff you could talk about, and stuff. And I get to talk about all of this stuff over time. And you get to learn it in a place where in the environment where we hanging out, we at the club, we learning the same thing the same way because I'm learning too again, and everything. So this is what I look up. So we're gonna get to the endocrine. So it's diabetes, thyroid disease. Oh, I said that one already. I'm sorry. It's kidneys. So it's kidney disease. You need your kidneys so you can pee. Or it's called dialysis, and stuff like that. So okay, I'm just saying. So kidney failure, which leads to dialysis. So that's a renal problem. Renal means kidneys, is referring to your PP program, and stuff, peeing and stuff like that. So that you see why I say peeing or urination or renal or genital urinary. Sound like a big old word and stuff, and it just means your kidneys and how they get down. Okay. So that's what I'm saying. And then there's muscle skeletal conditions. Okay, it's a muscle skeletal. So a skeleton is some type of bones, and muscle means your muscles. That sounds about right. That's the easiest one instead of muscle skeletal conditions. Like arthritis. Name somebody that got arthritis that you know of. Grandma, grandpa, auntie, uncle, cousin, whatever, okay? Yeah, that's how muscle skeletal conditions, that's that arthritis. Inflammation of them joints and ligaments and all that other good stuff. Osteoporosis, meaning a sponge. Like if you look at a sponge, it got all them little pores. Osteoporosis, osteo's bone. Porous is like a sponge with those little holes in there. You want a good solid bone in your body holding you up. If it got all these pores, it's gonna break easy. You're gonna have a problem walking and moving. And if it break on the wrong end and it's unable to be put back together again or something like that and stuff, you got a problem. You're gonna be crippled. So that's where that comes from. Joint disorders. There's a lot of other joint disorders, and different herniated discs and that's where all of that comes from. And chronic pain. Oh, my back just be hurt. I lifted 2 boxes and now my back feel like somebody then took a chainsaw and cut me in half and stuff and then put it back together and put some gum between there or something. And yeah. Or like one of them Jurassic Park dinosaurs that bit my back and stuff and then didn't put the stuff back. He just left it there and just chewed it up and stuff, left it there. Yeah, it hurt. Okay. So that's where chronic pain come from. And then also find out about this cancer. Yeah, we all know, they got cancer. You know how many people, when I told them, my mother was diagnosed with cancer. My friend had that in her pinky and she died. My friend had it in so-and-so and they died. And the so-and-so and they died. You know what? That is probably true. That, cancer does kill. That's what it's there for. To kill you. It don't know nothing else to do. The only job it got is to kill you. Now, it's some doctors, a special set of doctors, that their only set of things to do is to find how they could drag cancer and beat the hell out of cancer and to come up with some stuff where they could try to get rid of it or do their best, and stuff to help you live longer and stuff. But you know what? The coldest part is everybody say that about cancer and stuff. But guess what? You die from diabetes. You die from high blood pressure or heart disease in general, whether it's, heart failure, whether it's, all these different things. You die from so many other things, vascular disease, where your blood is not circulating circulating the way it's supposed to probably circulate. So some parts of your body will die off and things get cut off and different things like that. You could die from a lot of stuff. And the coldest part is sometimes people will die from a heart attack or they will die from, a diabetes or something like that. And they had cancer in their body. You didn't find out about it because you didn't know. You was concentrating on diabetes. So you didn't know to look for cancer. But if you told your doctor that grandpa had it or grandma had it or father or mother or sister or brother or cousin had it, they might have been able to look for that. So you see where all this stuff is coming in at? I done found the blueprint. I found the blueprint. I'm just trying to tell you. So that was the musculoskeletal, and I said and also the cancer and stuff like that and everything, because early detection, you got options. You get to live a little bit longer. And who knows, you might not die of cancer, you might die of something else. There is strokes out there. There is heart attacks that you might not be able to come back from. I'm not saying it like to scare the death out of you. I want to scare the life into you by going to tell, so that somebody is on it and you take that medicine and you get what you need done so that you can make it. Or you can not, and ignore it and everything. And guess what? It's going to take you out. Oh, he was too young. She was too young. I bet they was. They didn't tell on it. Okay. I told on mine. Guess what I got to do? Take me a little pill. Boop. Boop. I'm alive. Because I tell. I don't want to tell all the time that the shot hurt me when they take some blood from me. It hurt. I told y'all maybe a couple podcasts ago that I got a Tdap, which is tetanus vaccines. I got 2 in this arm and 1 in this arm. And it felt like, I always think of Jurassic Park because they be chewing off arms and stuff like that. It felt like they chewed off my arm and then slapped me with them and then put them back on I'm a nurse. Yeah, it hurted. And I give shots, but I don't feel them. I give somebody else a shot. But guess who had to take a shot? Me, because I told on myself and I went ahead and got me some shots and stuff and a particular set of things. So you see where I'm going with all of this? I'm just trying to help you. I'm trying to help me. I'm going to tell you, I'm a little stingy. I'll be trying to help me too. And stuff. Auntie Josie said, yes, real talk. Exactly. And I mean that about what I said to you earlier, Josie, about my uncle and stuff. Okay. So also we discuss one issue at a time, what's going on. So let me just break down what I mean and stuff. This is on Your Body is a Snitch, Believe It presents Medical Talk in Layman's Terms with Nurse Charlene. And we discuss one issue at a time. And we believe learning is easier when the topics are presented one at a time. I can't tell you about your gut and your brain and a neurological disorder and high blood pressure and stroke and kidney disease and all that. I'm not doing that. I'll be asleep. And I'm supposed to be the presenter. You see what I'm saying? So could you imagine trying to listen to it? Yeah, it's not cute. It's cute when I can do one at a time and I can really get my finessing in and stuff like that. I don't know every single thing. I don't even try to know every single thing, but I try to make sure that I do learn it if I'm going to teach it to you. I do take that much time out. So each episode may include this: definitions. Don't I always give you a definition? We doing this, or we doing the gut. The gut is the gastrointestinal system, or I'll show you a picture or something like that and stuff. That's what I'm doing. Welcome on in, Sonia. I see you watching and stuff. And then the causes. I'm gonna go over why you got it. What happened to make you get this? What happened to make you get that? Why did I get it? Whatever and stuff. I'm okay. I'm transparent and stuff as I can be and everything and stuff. Why does it happen? And then the risk factors. Who is at risk? The old people, the young people, the babies? Well, we all know that we got babies. We all know that we got teenagers and adolescent, children, young children and stuff like that. We also know that we are, as adults, we might have a certain set of things and stuff. Young adults have a certain set of things and stuff. There's drugs and all this stuff, and it might be drugs all the way into their 70s and 80s. Now they seniors. They got a certain set of things and stuff and so on and so forth and stuff. So we discuss them. Also, we discuss signs and symptoms. The snitch. We discuss what it do to you. Oh, you got a headache. You have one every single day. You took a little Tylenol, it went away, and then you woke up, it was there again. Yeah, you probably need to get that checked out because with the Tylenol didn't heal it, huh? So it's probably something wrong. That's why I keep on telling you, hey, you don't want to, I'm a blur the vision. Oh, you brave. You went and put you some eye drops in there and your vision came back and so you go, so I'm gonna break the ankle. I'm gonna give you osteoporosis. Yeah, it'll do something to you. Keep on playing with it. It's gonna play with you and stuff, but it ain't a good player, and stuff. It's mean and stuff. Rosie Granny Allen said, very good lesson. Say that one thing. That board. Oh, you love that board. Oh, okay. The board behind me, because I've been trying to draw little cartoony things, but they mean something if you really read them and stuff. And you could go back on the replay on it and stuff. But that's what I'm saying. Different things like that. But also, I said signs and symptoms. Then treatment options. Dang, when I went in there, they're gonna do an X-ray, and then they did a CAT scan. They supposed to do an X-ray and a CAT scan so that they can see, MRI, take slices of your body. A CT scan is pretty good at, catching something right away and stuff, and it take a certain little scan of your body, and then it goes and zooms in right to that part that's acting up, doing the fool on you and stuff like that. So it does that and stuff. So that makes sense and everything. Then you got, different things. They gonna take my pee and then here they come with the little needle trying to get some blood from me. Yeah, they need to know. Is that potassium low? Is that magnesium low? Because guess what? If it's too low, you die. Your heart stops and you die. If it's too high, your heart stops and you die. Oh, that's mean. No, that's reality. That's why they do it. Okay? And stuff. They're not full heroes. You the hero because you told on yourself. So they're a partial hero to it and stuff in this Marvel comic series, and stuff like that. And the Marvel comic is they actually know to test for this, and this, because you told them this hurt, my butt hurt, and my little front part hurt, and so y'all know what that means. But I'm just saying, whatever it is, that you say, my jaw hurt. Look at it, it's swollen. Look at it, it ain't swollen. Look at it, it hurt, and stuff. My ear fell off, and stuff. They need to know. And everything. Welcome on in, Miss Whitney and stuff. My niece, she said, great information tonight, Auntie. Thank you. This is what I'm on for. This is exactly what I'm on for and stuff. So then also prevention. So I said, this is what I do. Every time you can expect this when you get on the podcast with me. You're going to expect whatever the topic is, I'm going to give you a definition. What is it? Because sometimes you might not know. Sometimes I might not know. Because I will give you the chance to say, why don't you do this? Or something like that. And then I look it up and I say, I'm going on tonight with this. Or I'm going on next week with this. And stuff. And that's how I go. But you can expect this. A definition. I'm going to tell you what I'm talking about. The causes. If it's something that you could get sick, it got to have a cause. So I'm going to tell you why it happened. I'm going to tell you who's at risk. Old, young, baby, and stuff like that. And then I'm going to tell you some signs and symptoms. If you get a fever and your eyeball fall out and roll across the floor, that's probably what it's going to do. This one does that, and stuff like that. So you'll know straight up. My eyeball already fell out. I went and got it and put it in the cup, or something. But and stuff like that. Then you got did I say signs and symptoms? Then you got treatment and stuff. How's it treated? They give you antibiotics. They don't give you antibiotics. They give you water. They give you fluids. They don't give you fluids. That what they do? They punch you 3 times in your gut, or whatever it is. It's a treatment to it. And then there's a prevention. How to not get this no more. How to not get diabetes no more and stuff. It probably is a little, you got to work on it and stuff. But yeah, probably not eating the whole cake. not eating Twinkies all day long as if it's a side dish with every meal, and stuff like that. It's certain things. If you eat sugar, your body needs sugar. If you eat hella sugar, it ain't a bad word, hella. If you eat hella sugar, you probably gonna find out and stuff. It's just as simple as that. If you got high blood pressure and stuff, and stuff, do you eat heck of salt, or do you slow down on the salt because it's probably bringing up the blood pressure? You see what I'm saying and stuff, or bringing up swelling and edema and stuff like that and stuff. So in order for you to make it through whatever was going on and stuff, you got to know the reality of it. So that's the prevention also, so that how to not get it. But if I eat all of this, or I drink all of this, or I smoke all of this and stuff, yeah, I'm probably going to get this. So just know that you probably going to get it. You don't get to be extra special. I did everything and stuff and nothing ever happened to me. You're lying. That happened to you. You know how to lie and stuff. So that's what I'm saying with that. So I'm just going to quickly go over the blurbs and stuff, and then I'll get you guys out of here before 8:30. And that would be the take-home message and stuff, which is good and stuff. What every listener should remember. This is at the end when I'm finishing. Like, I'm gonna finish this one a little bit earlier and stuff, but I had a lot of glitches. That's why I'm staying on a little bit later and stuff. That's because I got kicked out 2 times and stuff. And cousin Maria said, don't punch my computer, be good. Okay, so I'm not gonna punch. Okay, and stuff. But what every listener should remember. Okay, I should remember, don't beat up my computer, be nice, and it might work a little bit longer for me. Okay, that's one. And then the other one that I need to worry about is we have guest speakers that come on from time to time. My guest speakers can be a slew of anybody and stuff, at the time. So watch out, because you might be one, and stuff one day and stuff. But I'm saying this to say that when I get the guest speakers on, it's usually to talk about a certain area of expertise that they have, either from experience, like I had a stroke, I had cancer, I have or had congestive heart failure and stuff. I'm on dialysis. So we might do a kidney section, so on and so forth. So that's where I get the guests from. I had me personally, your nurse, the host, COVID. And I'm a COVID, what they call it long COVID now and stuff, but I was called a long hauler and stuff. My COVID was so early on that the public health nurse followed me, CDC followed me. I was like, damn, do I got the plague or something and stuff? It felt like the plague though, so it might have been the plague. But anyway, I had those, employee health, my doctor, their COVID surveillance department. I had all these people studying me, and they did a case study on me and how I kept my antibodies for about 9 months, because it hit me so incredibly hard. Like, I went to Wuhan, China, and picked it up and brought it home with me and stuff, that they were so interested in that I had on my lungs a ground glass appearance across both my lungs. And never been a smoker, never ever been a smoker. And I had ground glass appearance. I was like, well, vacuum it out. Like, y'all got something, put me to sleep though, but take it out. Yeah, it ain't no taking out. It's on there for the rest of my life. And I found out, I thought I was better, and feeling better and stuff. But I found out if I spray Febreze and I don't get the hell out of the room, I'm going to find out. You're going to hear me in there. I can't even smell Febreze and live. So guess what? That was in 2020. It's 2026. and stuff. You see what I'm saying? So the whole matter of that, it doesn't matter. And I am not the COVID police to anybody that might be concerned about that. I'm not the police. I want to find out how you could get better, because I don't want you to die from it and stuff. But I can't even smell. I had a humidifier going with some I think it was lemongrass that was supposed to come out the little smoky thing. I had that thing by my bed and I was like, ooh, the aroma. Yeah, I started choking to death. It was like somebody blowing a cigarette in me, but I don't smoke, and they just blew it straight in my face. And I coughed and coughed and coughed. I turned that thing off, and 5 minutes later, I was like, it never happened. That's how bad. Yes, cousin Tony said, wow, yes, that's how bad it was. It almost took me out of here, took my life. And I'm a still spray for Breeze and Lysol and alcohol, rubbing alcohol, 91%, and all of that stuff. Because you ain't going to stop me from doing it. I'm just going to be a little bit more cautious and stuff, because I had to faith around and find out that I'm not invincible anymore. My lungs got touched by that stanky COVID and stuff. So that's the moral of the story. So just think about that. Life on me, because guess what I got that y'all got? A human body. And so just like you get a cold, I get a cold. You get a fever, I can get a fever. You get this, your hair fall out, my hair fall out, and stuff. Everything that you get, I get. I can't see. I got my glasses right here. Boom. Boom. Where's it at? Boom. Exactly. So I'm saying that to you to let you know that, yes, I'm a nurse. And the difference is not because you're not a nurse and I'm a nurse and stuff, like it's all perfect and stuff. It's just that I have the nerve to tell on myself a little bit faster than you, probably. That's my superpower. I'll tell on you faster. And the fact that I did take the time to read a few books and get educated and get a couple degrees, 1, 2, 3, 4, but and all of that stuff. And I've been through a hard knock life, but I'm living it just like you. Dad said you might have to wear a mask. Exactly. But who hard-headed? Oh, you dirty. Did I go out, y'all? Am I back? Ooh, you dirty self. Oh gosh. Okay, I'm finishing off, y'all. I'm gonna finish it up. I'm saying all of that to say this is why I'm here. This is exactly why I'm here and stuff. So our potential guests that will be coming on, and look forward to this because it's going down. It's going down as soon as I get a new computer. Bye. Okay. But anyway, is guests that might be able to come on. Dr. Bonnie from Eden Hospital Emergency Room. And she has a book, and I'm going to promote it and everything and stuff. Other nurses, because I'm a nurse and I got colleagues and stuff, and they respect the game and what I'm doing. Okay, thank you. It's like I seen it, just the whole screen turn blue out. But anyway, pharmacists, because sometimes the pharmacist can give the wrong medicine, because guess what? They're human. So you can't even say, oh, it's just a pharmacist problem. No, they're good. They just as good as the doctor. They be like, doc, you ain't supposed to give this with this. So sometimes the pharmacy will catch it, and stuff like that. They're allergic to this. Why are you giving this? And stuff. So they look out for you even faster than the doctor can. The doctor might have prescribed you ampicillin, but you're allergic to penicillin. They in the cyllin gang. They in the gang. They different, but if you had something really bad happen to you with penicillin, you might not be able to take that ampicillin. That's what that is. So that's where that pharmacist is gonna come in and be a good candidate for you. That's an advocate and stuff. You got your therapist, the mental therapist that actually talk to you. Charlene, you're not crazy. Crazy is not a mental illness and stuff, but you do got schizophrenia. No, I'm just playing. But I'm just saying, so you just never know. and stuff. You got nutritionists. Yeah, when you see me with the little food table and I said you only can put this much in your hand and that should be how much meat you have on your plate. And you had this, you had Godzilla hand talking about, I want to eat out of Godzilla hand. I don't want to eat out your little tiny hand. That ain't gonna give me no food. I'm gonna be hungry. The difference between that. But you can fake around and find out and be super big or something, or super unhealthy, you know, and stuff. So it's a difference, and that's why there's nutritionists. They want to give you good nutrition or safer nutrition and stuff. And strawberry shortcake, I found out, is not a safer nutrition and stuff. Okay, if you eat the leaves, baby, to the strawberry. But anyway, social workers. There's actually people that actually care about you and get you connected to the right things so that your life is not so stressful, because then you're not coping. Okay. Mental health professionals. So the social worker can work with you on getting you a mental health specialist that can help you with that PTSD, with that anxiety, with that anger. Anger is actually a disease that you can have. And if it's not controlled, you could do something like go postal and shoot up everybody at your job, or, you know, something like that and stuff. So there's really a thing. There's physical therapists. They help with getting them legs, you know, see if they can get your legs moving, get your body moving. After surgery, you deal with a PT, like cousin Tony was talking about and stuff. They wear you out and stuff, but they getting them arms moving. If you don't move it, you lose it. So yeah, you got the surgery and you told on it. Now what you gonna do? Just sit there and just hope it get better if you don't do nothing and you don't look at it? No, you gotta learn how to walk again with it, with this new part inside of you or something like that. So it's a real big deal and stuff like that. Then you got occupational therapists. That's the ones that tell you, yeah, can you cook for yourself? Can you feed yourself? Can you do this and that and stuff? So they help and work hand in hand with a physical therapist. You see where all this stuff is coming from, you know, and stuff. Yeah, you could ignore it. And if I don't look at it, it didn't happen. Yeah, you're going to find out. Yeah, when it's going to start working all together, it dies and stuff and everything. Then you got community leaders that might want to come on. These are all people that y'all gonna get to see if y'all keep watching me and stuff like that. So community leaders, I got people lined up and stuff ready to come on and tell you what's going on in the community. We got inflation and stuff, gas $7 and $25,000 and stuff like that, a gallon and stuff like that, and what you can do and how you might be able to get some resources together. Help you pay the PG&E bill so you can take that $18,000 from the PG&E bill and put it in your gas tank and stuff like that, and you know, and everything and stuff. So I got that coming on. I got healthcare advocates, people that help you navigate the healthcare system. They tell you who to ask what and stuff, Auntie Josie, like how to find out who dropped the ball on Uncle's medicines and stuff like that. Get him the wrong, incorrect medicine or dose or whatever it might have been. It was just wrong, period. He didn't ask for that. He wanted to live, you know, and stuff like that. So, and he shall and stuff. So they caught it and stuff. Then also survivors and caregivers will come on. Cancer survivors, caregivers. I'm already on, but I'm, you know, nurse, caregiver, whatever and stuff, whatever I could be that God will bless me with and stuff. That's what I'll be and everything. Also, what else is there? That's my potential guest lineup. Experts in certain supplements and stuff that are really, really good for you. You could take this cheap one that ain't never fixed you in years. And usually when you go get a colonoscopy, it come out of your butt in the colonoscopy with the letter still on it. So did you get it? Yep, you probably didn't get it. CENTRM. Yeah, but anyway, I'm just saying, you know, or different medicines and stuff that you take and you think if they come out whole in your butt, they did put too much plastic around it or something because you didn't get it. It didn't go in you and do nothing for you. You took it for energy. you still ain't got no energy, and it didn't do nothing because it didn't even open up so that the body can process it. So yeah, getting you the right ones that break down right on in that stomach and do what they do, and you level up and get that energy. Okay, and then what else? Survivors and caregivers, and then why guest speakers matter. Because guest speakers provide diverse perspectives, meaning a roundabout of perspectives from this end, from that end, from this end. This might not touch you, but it might touch somebody down the street from you that you care about, or up the street from you that you care about, or something like that and stuff. So it touches those people and stuff. Then also you got professional expertise. Like me being a nurse, I'm a professional. I am one of the professionals. I'm just not your professional because I can't be everybody's professional and stuff. But that's where it comes in at. And then real life experiences. Yep, I had this. I had COVID. I'm a COVID long hauler. Now they call it long COVID and stuff. Yes, I had ground glass on my lungs. That's your nurse that's talking to you right now, and stuff like that. Your host and stuff. And then you got community resources. How to go and get you some food from the pantry and not feel bad about picking that up. Stuff is high. It's expensive and everything. I see that, Tony. I'm fit to read that in just a second and stuff. We're gonna do testimonial Tuesdays, and I'll wait because I want to hear this and see this stuff. Cousin Antoinette said, I want to challenge all my family tonight to bring, or again, your cousin, thank you. You always do invite one person next week to the podcast. Oh, okay. I love this. And we need best job each week to get the information out to all our friends and family, and because I know there is at least one person we all know that could use this information instead of sitting in the dialysis clinic, emergency room, or hospital. That's my suggestion for next week. And as always, because you did a very good job. Thank you so much. Now, you see, she's gotten to that understanding. You all have. Everybody that's stayed on here and everybody that'll watch the replay, you're going to get to the good part. And although it's a glitchy thing, you see how the devil make it glitch on something this important. Why am I on here? Why am I not really playing? I do try to joke around and stuff like that. And I joke around. I'm stressed out about this computer doing this, but I'm trying to joke about it and stuff. But it is serious, because what I'm talking about really means something to me, and it will mean something to you, because once you take the time to digest it, go back and replay and check it out and stuff, you'll see that this is some real stuff that I'm not even playing on here and stuff. But I love what you said and stuff, and I'm a actually capture that, and I'm a repost it. I'm gonna repost that and stuff. You did really good, cousin, and stuff. That's wonderful and stuff, to be able to challenge everybody, family and friends, because we're all a family. Once you come on the podcast, you automatically become family and stuff. And so while we're on this podcast and stuff, that we bring somebody to this. Instead of talking about it's this girl, Charlene, she a nurse. She been a nurse for a few years and stuff like that. And she kind of smart and stuff. She be trying to do her thing and stuff like that. But, instead of telling them and then, and stuff, getting them to watch it, see if they even interested in trying to find out and stuff. But I don't want to see any more, or I want to lessen the blow of you got this. And it ain't nothing we could do about it. It's too far gone. We can't operate. We can't do this. We can't do that. Yeah, you probably got 6 weeks to live, or no. They got a lot of stuff that reverses this stuff, even diabetes. My mother's diabetes got basically reversed, stuff like that. They got stuff out there, I'm telling you, and stuff like that. I was pre-diabetic and dropped back down to normal and stuff. There is really ways to get this going and stuff. So just remember, there's still some hope out there. You just got to seek it and find out. And Auntie Rena said, you are one of the best nurses. Gone with your best. Thank you, Auntie Rena. And Dad said, it might just be the internet. I hope it's something stupid like the internet and stuff. But I got AT&T fiber optic. They supposed to be the best, huh? No. So they probably kicked me out the computer and stuff, be playing with me and stuff. But we're going to find out. And Dad, you can help me and stuff. So I'm going to ask you and stuff probably tomorrow in the morning and stuff. But anyway, going back to this and stuff and ending it. Thank you, Antoinette, for that. That's beautiful and stuff. And like I said, I'm gonna capture that. I'm gonna repost that because that makes sense and stuff to be able to get you guys to be my advocates for me in this podcast. By if it helped you in any type of way or any of them, because you can go back and see the catalog on YouTube under Medical Talk and Layman's Terms with Nurse Charlene, and you can find all of them and see how I kind of leveled up from just a little bit here and a little bit there, and how I start getting better and better, and my syllabus got better and better. It took me time because I didn't have a whole grid of how to start this podcast and what to do. I just know that when I'm being taught something, this is how I like it. So if you're being taught something, you probably like it this way too. And stuff. I had bigger words, and stuff sometimes and stuff like that, but the same thing and stuff, just knowing this. So that cardiovascular doesn't sound so harsh, like, what is that? And stuff. Yeah, that means your heart and your heart veins and arteries. That's what your vascular system, how the blood flow through your body. Yeah, it ain't fancy, but it can sound fancy. Okay. So just finishing off and stuff, because I said 8:30, but it's gonna be about 2 more minutes, and that's to say that I'm going to be doing Testimonial Tuesdays, which is a special segment dedicated to real people sharing their stories, sharing that story about that surgery you just had, sharing that story about that family member that's going through something, only if you get permission and stuff. So you don't want to give names, you don't want to give date of births and all of that stuff on there, because we do need to stay within that health information privacy and everything. But even you and stuff, you don't have to tell my doctor name is Dr. Johnson and he be doing this and doing that and stuff. You don't go all into it like that, but just being able to say that, yes, this is the care that I received for this and everything. And I went through this, and stuff, because we already did it. Auntie Josie told me how she, because a stroke doesn't hurt, how she dropped her grandson off in Oakland and got on the bus and rode all the way back to San Francisco, where she stopped and had lunch while having a stroke. And she didn't even die, and got on the bus and went to the hospital. If that wasn't God trying to keep her, because she's still here. And that was years ago. So the moral of that story is she actually had the nerve to still live and not die of her stroke. And still she has movement. She can walk and everything. She can talk. She didn't lose all of it, maybe temporarily, but that's what I'm saying. That type of stuff. So Testimonial Tuesdays, that's where that comes in at. Yes, it is the Lord and stuff. So Auntie Josie said, you really educating us. Love it. I'm learning so much. Absolutely. But I thank you, but it's a two-way street. You got to be ready to accept the information. I can do all of this, and I can tell you about all of this and every little thing, and all about weed and all about scissor and pills and Molly and all of that stuff. I can tell you everything. And guess what? If you're not willing to learn, you won't. If you're not even willing to help somebody else and actually had a nerve to care about somebody else, they get to die. Because you around them and you got the information and you didn't even pass it on. You didn't pay it forward. So it's a give or take and stuff. I can keep it all this stuff that I just told you over this hour and a half in my brain, but that ain't helping you and everything. So that's where all of this is coming from. And I thank you guys. I thank you for being kind to me. I thank you for listening in and really taking this in and taking this under consideration, because you all then found out. Y'all found out you didn't had a surgery. You didn't had this. You didn't have some blood. You didn't had to give up your urine, and stuff. You didn't had this medical condition. You didn't had that medical condition. You didn't had all of this stuff. So, I'm telling the truth, and stuff like that. Auntie Josie said, yes, Lord. Yeah. And stuff. And so, another thing that we're doing on here and stuff, because I might as well just get it out, because I know that was the devil trying to get me off of here and stuff, is product highlights. And that is the podcast proudly features products, services, and resources that support healthier living. Like, I have other things. I have several businesses all running right now and stuff. And one of them, they have some of the God's given best vitamin supplements in the world. The world, Craig. They melt in your body. They don't come out in your poop and stuff. They actually melt inside your body and give you vitamin B, vitamin K, vitamin D, vitamin A, B, C, D, E, F, G, and all of that stuff. That type of stuff. And you could take the other ones, but you're taking a chance. At least look them up, vet them out. Nature Valley might really have some good Nature Valley vitamins. But what if they don't? And you taking them every day and they ain't doing nothing, and you think you getting ahead and stuff. So that's where it comes in at. So product highlights, medical devices, like showing you what a pulse oximeter is and stuff, where they put it on your finger like ET. Let me see right here and stuff like that. And then you turn it on. Let me see if y'all can see it, like product highlights. So I'm just trying to get it out, you guys, and stuff. But, having one of these and stuff, and it tells you what your oxygen level is supposed to be. And if you used to be a smoker or something like that, you probably got lower oxygen. And if you wasn't a smoker and stuff, it probably is a little bit higher, 96, 97. But if you had COVID and now you messed around and found out, you might always be at 95, no matter what. And you didn't even smoke and stuff like that. But if you did smoke and stuff, you might be a little bit lower, 94 or something. But, to each his own and stuff. Thank you, Rosie Granny Allen said, teach, Charlene, teach in Jesus' name. Amen. Amen. I love you, Mom. And also cousin Antoinette said, thank you, cuz. Right and stuff. I'm almost done for anybody that just could stay on just about 2 or 3 minutes more. And that is, we're doing the product highlights, medical devices, community resources coming up again and stuff, educational things where maybe I might be able to send you out something or invite you somewhere and stuff that people can make it to and get you some items that you can keep at home, like that thermometer, and send you a coupon so that you don't even have to pay the full price and stuff like that. Blood pressure cup. So you could be taking your own blood pressure, know your own blood pressure, know your numbers, instead of having a heart attack first and saying, I didn't even know I had that, and stuff like that. Self-care tools, knowing that you really do need to wash your sheets and clothes and stuff. And it's a part of personal hygiene to wash them weekly, washing them covers. If you leave it on for a month, you got a month worth of whatever came in with you. If you go to bed and you sit on your bed with your dirty clothes from outside and stuff, and that you might have left you a little package there and stuff, and that it catch up with you, and next thing you know, you got pneumonia or something and stuff, that's how you get it. It pull at your immune system. But just knowing those things that really count and stuff. And then products and gear. So see why I said don't get off yet, y'all. Don't get off, please, please, please. If you do got to get off, no matter what and stuff, just catch the replay, because this is the good part and stuff. Nurse Charlene gear. This girl been designing gear and stuff. Your body is a snitch t-shirts. Silence is deadly, with the little lips and stuff like that. Like, you snitch and you gonna die. Silence is deadly. You gotta tell. It snitched on you. You got to tell too. Okay. But anyway, the merchandise will include t-shirts, hoodies, hats, totes. I got all of this right now and stuff. And then also coffee mugs, water bottles, journals to write down your numbers every day. So you could be on top of your stuff. Ain't nothing gonna get you and stuff. You gonna get it. You gonna fight cancer. You gonna fight kidney disease. You gonna fight diabetes. You gonna fight what else is there? Endocrine problems and stuff. You gonna fight arthritis. You gonna fight. Okay, and stuff. So Nurse Charlene gear and stuff. And I ain't gonna tell you about the slogans. I'm gonna keep that one though and stuff. But the non-judgmental environment. As everyone is welcome. We recognize that the health journeys are personal and unique, so we're going to provide at all times. This is my rules, and that's respect, compassion, inclusion, education, understanding, and empowerment for everybody. It ain't going to be no shame, no blame, no judgment. We starting the national anthem and stuff. It's no shame, no judgment, no blame, just information, support, and encouragement. We're gonna find out how to get to the food pantries and stuff. All of us can be there getting juice and milk and all of that stuff, and nobody has to feel sad because this and that and stuff. You seen how much it costs? Give me mine free and stuff. And then also who should listen? Everybody. So this is going back to Cousin Antoinette and what she said, start practicing bringing one person. Like, this girl really be knowing what she talking about. She got the nerves to be really saying something, here and stuff. And it's kind of cool the way she got it set up, and you can say stuff. She'll give you a shout out and thank you for coming in and all of that stuff. And, she'll let you watch the replay. If you don't want to talk and stuff, you don't have to talk, and stuff. Wait till you get comfortable. And if you never talk, you never talk and stuff. It's okay and stuff. But there will be no judgment on you at all and stuff. The people that should listen: patients, family, caregivers, students, healthcare workers, other healthcare workers. They can get pointers so that they can take back to their co-workers and so on and so forth. Seniors need to know. Young adults need to know. Community members need to know. And if you have a body, this podcast is for you and everything. The listeners, you can expect this at every podcast, no matter what. Even if I'm struggling or shuffling my words, I'm shy still and stuff, but I try and stuff. Accurate health information, simple explanations, interactive discussions where we go back and forth. I show you things and stuff like that. Expert guest speakers, doctors, nurses, other nurses and stuff like that. People that have a right in their field, teachers and stuff like that, all types of stuff. Health tips, prevention strategies, how to not get whatever and stuff. Real life testimonials. I had that surgery because I had this, I had that. Auntie, and stuff like that, and different things like that. Product highlights. I'm gonna get that gear. I'm gonna start wearing my gear and standing up showing you, show you I'm proud. I got hats, everything. Community engagement, being able to know where you can get more stuff from and everything. Inspiration and hope. Food pantries and all of that stuff. And then the conclusion. Your body is constantly communicating with you. Every symptom, every change, every ache, every pain, every unusual feeling is a message. It's snitching. The message is a snitch and stuff. The question is whether your body is talking. It's not whether your body is talking. The question is whether you're listening to it before it's too late. At Your Body is a Snitch, Believe It, LLC, we teach people how to recognize those messages, understand what they mean, and know when to seek help. One conversation, one lesson, one symptom, one life at a time. Your body is a snitch. Believe it, because your body always tells the story, no matter what. And it's hosted by Nurse Charlene, Medical Talk in Layman's Terms with Nurse Charlene. Thank you, guys. And I thank y'all for everybody that stayed on the extra time and stuff. I appreciate you guys and stuff. Now I'm going to release you to go ahead and live your best life. And just remember, your body is talking. You got to listen to it. My body is talking. I got to listen to it. Or guess what I get to do? Find out, just like you. Okay, look at it. Look at it. Oh, you get okay, bye, you guys and stuff. I send my love to you and stuff. Thank you for getting on here. Thank you for respecting me. Thank you for hanging in there with me. This is the strangest podcast I've ever done so far. And it's cold-blooded, and it was the best podcast. And I'm going to do it again just because this happened and stuff. But y'all take care and take care of each other. And we got this. We got this. And guess what? They don't understand that I got a touch screen. So I'm not going to even touch this little dumb mouse. I'm going to actually hit the button up here and stuff. But thank you guys and stuff. Thank you for hanging with me. And y'all take care and bye. Good night, everyone. That's what Auntie Josie said. Good night. Oh, it won't let me do it. Woo!